The number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing. Wear a mask if you have to leave your homes and wash your hands thoroughly and frequently as we all strive to stop the spread of the virus. Welcome to InfoHub for Monday, May 25. Thanks for joining us. Some great news in the health sector. The new Port Kaituma District Hospital, costing more than $900 million, has been officially opened to serve the Matakai sub-region, eliminating the need for residents to travel to Mabarumo or even Georgetown for specialized healthcare services. Delicia Haynes has her first story.
The hospital complex stands at approximately $959 million, ready to deliver a wide range of healthcare services in a modern environment. Minister of Public Health, the Honorable Valdo Lawrence, noted that the realization of the long-awaited project emphasizes the government's vision to narrow existing gaps in the public healthcare sector.
In keeping with the vision of the Ministry of Public Health and His Excellency President David Granger, to ensure not only that there is a good life for all, but that there is a healthy life for each and every Guyanese. We want to eliminate those mitigating factors that will separate them from the quality of care that they receive. Everyone, everywhere in Guyana, must receive the same health care.
The Port Kaituma District Hospital is the only health facility in the region with a water filtration system and a wastewater treatment system. In addition, an internal medicine specialist and a pediatrician will be working out of the sub-district for the first time. Regional Health Officer Dr. Stephen Shifun outlined how the services of this hospital will benefit residents in Port Kaituma and by extension the sub-region.
No longer would you have to go to Mabaruma for x-ray services. That would be offered right here in Matakai sub-district. Before, we spent thousands of dollars to send people to Georgetown just for an x-ray. Fractures, we couldn't diagnose it properly here, but now we have an x-ray service for the first time.
The construction of this facility started in 2014 with the previous administration contracting the project to Arbasu and Sons and Calitech as the supervisory consultancy firm overseeing the project. The initial project was valued at $700 million. The project was abandoned due to many issues, including the fact that there was no clear vision of how it would be executed. For InfoHub, Delicia Haynes.
52-year-old Mabarumo businesswoman Lolita Wong survived the novel coronavirus. In this story, she shares her experience of pain and even discrimination. Let's take a look.
As part of a regular routine, Lolita Wong traveled to Georgetown in early April to do shopping for her business back in Region 1. She said she traversed many areas throughout the city as she obtained items for her business. 8 days after, she returned to managing her business in Mabaruma. It was shortly after then that she experienced body aches and pains with a constant dry cough among other symptoms. After giving it some thought, she engaged a doctor and was advised to have a COVID-19 test done. The results returned positive and she was immediately isolated.
To be isolated is like even worse than the virus. Being away from your family, for being away. Well, after I go in, they tell me once you're positive, you have to spend like 14 days and then do a recheck. So on the 15th day, they did a recheck, right? The swab back. When the results come back 2 days, it was positive again. So it was like, I don't know if I could make this through.
As time went by, Lolita realized the impact of being infected with the coronavirus, not only on herself but those around her.
The hurtful part of this thing is, like, when you get a virus, the discrimination part of it is very, very sad because I went through it. A lot of people try to discriminate my family members, my workers, my staff and so on, and it was very hard on me. Being away from them wasn't really nice. The business had to close. Nobody wanted to do stuff for us.
She has now recovered and taken a stand to let people know that coronavirus is real and anyone can be affected by it.
A lot of persons right now, they're not taking it serious. Some people taking it politically, saying is not, COVID-19 is not real. This saying is because the election counted and a whole bundle of nonsense, but I know, I went through it and I know it's real.
Wong is also using the opportunity encouraging persons to stay home and practice social distancing. If one must go out, they are to wear a face mask and sanitize or wash hands frequently. For Info Hub, Delicia Haynes.
We now turn our attention to the national recount. Counting agent for the APNU plus AFC coalition, Aubrey Norton, says the discrepancies emanating from the ongoing national recount can no longer be considered anomalies, but clear evidence of fraud. Alexis Rodney tells us more.
These irregularities included the more than 8,000 unstamped ballots believed to be that of the disciplined services. Norton, who has been on the ground since the beginning of the national recount at the Arthur Chung Conference Center, told the journalists last Friday that there is a close correlation between unstamped ballots and the APNU AFC strongholds.
We have seen that wherever there is intermixing for the joint services, a large amount of ballots have not been stamped. These are not anomalies, clear evidence of fraud and rigging.
Norton said that the PPP has developed a strategy of focusing on Region 4 and its returning officer claimant Mingo, when it is clear all other regions recounted so far have unearthed massive rigging. Out of 600 plus boxes, the counting agents have discovered that many persons voted without certificates of employment. Agents have found some 59 such cases in Region 1, 110 in Region 2, 5 in Region 3, 69 in Region 4, and 7 in Region 5. There are also some 37 cases of dead persons voting so far. Norton said death certificates are emerging. Persons who were out of the jurisdiction at the time of the elections amount so far to 40 in Region 1, 229 in Region 2, 408 in Region 3, 310 in Region 4, 61 in Region 5, totaling 1,048.
They're saying Mingo rigged, but the evidence is suggesting that in Region 1, there was rigging. In Region 2, there was rigging. In Region 3, there was rigging. In Region 4, there was rigging. In Region 5, there was rigging.
Norton said that the PPP is also using another tactic, taking the results that are coming early in the ongoing recount and suggesting that the party is leading. He has, however, urged Guyanese not to be misled, since the opposition, like the coalition, has its strongholds. For InfoHub, Alexis Rodney.
Meanwhile, Chief Executive Officer of the National COVID-19 Task Force and former Director General of the Ministry of the Presidency, Joseph Harmon, today said that the APNU plus AFC coalition remains confident of victory despite the unearthing of a number of anomalies during the ongoing national recount.
From the trends we have noted, we expect to uncover more instances of fraud by the end of this process. But make no mistake, the APNU-AFC coalition has been and remains confident that we were successful at the polls. We, however, must stay focused on the validity of each vote, which gives credibility to the entire process.
He also noted the attempts to deny the coalition of the votes cast in its favor by the disciplined services.
What our agents have discovered is that on numerous occasions, these ballots were not stamped and they were deemed invalid. So what that means is that a vast number of our disciplined services, men and women, their votes were not counted. We have called upon GCOM to ensure that the votes of the disciplined services that they are counted.
Big news in the oil sector as the second million barrels of crude from the Eliza Destiny floating production, storage and offloading vessel was lifted last Thursday. Payment for the crude is expected within the first week of June. Earlier this month, Director of the Department of Energy, Dr. Mark Bino, confirmed that the country's second lift would take place in the third week of May. The country lifted its first cargo on February 19 under the entitlement regime that netted nearly $11.4 billion for its approximately first 1 million barrels of oil. Dr. Bino assured that the Energy Department remains committed to guaranteeing the revenues garnered will be properly deposited, noting that the department has been working with the relevant agencies to ensure this is done. More news after the break. Stay with us.
The following is an important message from the Ministry of Public Health. You can prevent the spread of the COVID-19 virus. If you have the following symptoms: coughing, fever, or difficulty breathing, please stay home. If you don't have these symptoms, then practice social distancing. Avoid crowds. When in a group, keep a distance of at least 3 feet between yourself and other persons. Please wash your hands with soap regularly or use hand sanitizers. The Ministry of Public Health has a hotline to provide information on the coronavirus. Members of the public can call 227-4986 or 624-3067.
Welcome back. The government of Guyana is working to help stimulate the economy by assisting farmers and local small businesses through several initiatives. Details from Natisha Isaacs.
Speaking during an interview with InfoHub, Minister of Business Hemraj Rajkumar explained that a new agency has been set up to organize assistance for farmers. The Coordinating Agency for Small Enterprises, CASE.
CASE, as we would we refer to it, it comprised of agency from the Ministry of Business and the Ministry of Agriculture, and part of its responsibility is to develop measures that would alleviate poverty, create employment, stimulate domestic production and consumption of locally produced goods.
Meanwhile, Chief Executive Officer of the Small Business Bureau, Dr. Lowell Porter, explained that the agency is providing stimulus grants to small businesses to offset expenses, pay staff, and purchase supplies. Over 500 persons have already registered.
We're looking for those who are in the food business, agro-processors, value added. But the bottom line is you come to us and we will start talking.
Application forms can be found on the Bureau's website, www.sbb.gov.gy, or their Facebook page, Small Business Bureau Guyana. The minister is encouraging citizens to buy more locally produced products in order to support small businesses and to stimulate Guyana's economy.
We encourage our citizens to buy more local things, then therefore you will indirectly support our local industry.
Letitia Isaacs for InfoHub.
Meanwhile, in response to the pandemic, the Agriculture Ministry has launched its COVID-19 Relief Kitchen Garden Initiative, which falls under the ministry's Rural Entrepreneurial Agricultural Project. More in this report.
In response to the pandemic, the Ministry of Agriculture has launched its COVID-19 Relief Kitchen Garden Initiative, which falls under the ministry's Rural Entrepreneurial Agricultural Project. The initiative aims to promote healthier eating, self-sufficiency, and to serve as a stress coping mechanism. Minister within the Ministry of Agriculture with responsibility for rural affairs, the Honorable Valerie Adams-Yearwood, explained the reasons behind the kitchen garden.
So many persons are home right now. They have limited disposable income. And we want to encourage them, because you would know that the COVID-19 persons are asked to bring their immunity levels up. And so we want to encourage people to eat right, to eat healthy, and to also engage themselves in kitchen gardens, which will help them to meet that objective. We're looking countrywide at food security for families. And we believe and we know that having the kitchen garden is one of the ways where families can be food secure.
The minister also shared a few options for those who are interested and eager to get started.
If you don't have space in your yard to put beds. Then you can buy containers. You have an old bucket, an old tub, an old pot, an old can. You can plant, utilize them.
Speaking on the benefits of a kitchen garden, Minister Adams Yearwood had this to say.
Because you're planting your own vegetables and fruits means that you're going to be eating organic, which is far healthier. It will take a lot of stress off of you.
Yes.
Because doing that activity will make you a little more stress free.
She also urged everyone to participate in the COVID-19 Relief Kitchen Garden Initiative.
I want to say to the Guyanese people, get on board immediately. If you have not yet done your registration and submit your form,
Interested persons can uplift forms at the security hut on the ministry's head office on Regent Street, their neighborhood Democratic Council offices, or regional agricultural officers. Forms are also available on the ministry's website. The closing date for registration is June 6, 2020. For InfoHub, Gavin Lewis.
Guyanese can look forward to spectacular performances from artists at home and abroad as this year's virtual 54th Independence Anniversary concert is anticipated to create a buzz on May 26 at 10 a.m.
Speaking with InfoHub, Program Coordinator Andrew Tyndall said that with the hosting of this concert, it is hoped that Guyanese are reminded of our resilience as a people, especially as we fight the COVID-19 pandemic.
We have decided to, along with our cultural ambassadors and the creative industry representatives, put together a program that will remind Guyanese of our resilience as a people, that will help us during this period to think about ways in which we can be innovative towards the development of Guyana, and also to think about how do we sustain this development in years to come, so that whenever there are future events like this, a pandemic or so on, we're in a better position. Our children will be in a better position to mitigate against the circumstances.
InfoHub also spoke with some artists who are set to perform.
A lot of my songs are patriotic towards Guyana because I just love Guyana, I can't help it. So you can look forward to the usual energy. Make sure you're representing Guyana. Whether you're wearing your clothes, you get a flag. Every person should get a Guyana flag in the house. So whether you have your clothes that are representing something happening, see if you could get your family to probably wear the colors. I mean, we may not be able to see you, but you can take pictures and post it so that we'll have an understanding of what's happening. But for me, it's going to be a whole lot of energy. Of course, I'm going to mix up some songs and just have it fun. For me, it's about fun, and I just want you to have fun because we're celebrating.
I personally am so happy about this concert that I am actually excited to be on the stage again, even though we have to do it under the circumstances where we don't have, the people, in live audience. But, for me, when I close my eyes and I look at the camera, I can be visualizing 300,000 Guyanese jumping and waving and tick-tocking. You understand? And you see, for this concert, I'm going to be doing some different music, new music, old music. You understand? Music that you never even hear I did before. You understand me? Show the versatility.
This year's Independence Anniversary is being celebrated under the theme Celebrating Guyana's 54th Independence Anniversary through the lens of resilience, innovation, and sustainability. Neola Damon, InfoHub.
And you can tune in this evening at 10 p.m. on the National Communications Network, Channel 11, for the flag-raising virtual cultural program. The Civil Defense Commission is urging residents in communities that are prone to flooding to take all necessary precautions against possible flash floods over the next few days. Those residing in hilly areas should also adhere to similar precautions as landslides may occur. The CDC's 24-hour National Emergency Monitoring System can be contacted on 623-1700, 600-7500, or 226-1114. The CDC can also be contacted through its Facebook page to report any flooding or landslides. The flood advisory can be viewed on our website. Now, remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, or difficulty breathing, please seek medical care early, but call that hotline first. That's all for today. Connect with us on our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. You can also subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Goodbye for now.